Canadians have long taken pride in their country being seen as a safe haven, a country that welcomes refugees, a place where troubled people can live, work and get health care while their bid to stay here is considered. But lately, it seems the welcome mat is not so welcoming. In an effort to deter abuse, the federal government has pulled back on benefits for some refugees. It's left them without any medical coverage, meaning they're now both unwanted and unwell. Carolyn Dunn has one woman's story.
It
is a rare moment of tranquility for Maria Morales and Ivan Nava, much like how the couple pictured their life in Canada when they moved from Mexico in 2009. They were trying to escape crime and violence in their home country, in a region of Mexico controlled by drug cartels and corrupt police. Amnesty International reports up to 15,000 gang-related murders in Mexico in 1 year. For reasons she still doesn't know, Morales' former partner, an architect and father to her now-grown son, was assassinated.
They had tied him to a chair. They beat him. I never wanted to know more. It hurt me too much.
Thugs started demanding money of Morales, following her in the streets. When she met Ivan a year later, she says the campaign of harassment continued against both of them.
Our reason for being here is that there were people that scared me. They asked me for money, and because they knew Ivan was my boyfriend, they threatened me of getting rid of him or me.
They fled to Canada, to safety, a fresh start. They applied for refugee status, and within months, both were working. Then, in the fall of 2011, during a night shift at Walmart, Morales began experiencing stomach pain and bleeding. Within weeks, the symptoms were too severe to ignore.
In November, I went to work with bleeding, and the pain was so strong and unbearable. Ivan took me to the emergency at Rocky View Hospital.
Imagine Morales' relief when, after a biopsy, she was diagnosed with fibroids, negative for cancer. She began the standard treatment. But 6 months later, doctors got a shock. They discovered during a hysterectomy, Morales not only had cancer, but it had grown well beyond her uterus. She was given a grim diagnosis, stage 4 cancer, much of it inoperable.
Cuando empezó, yo no lo podía creer.
I couldn't believe it. When they gave us the news, I felt so sad. I was with my husband and we hugged. We didn't know what to do. We couldn't believe it.
Morales' doctors ordered a review of that first biopsy result, which, as it turns out, did show evidence of malignancy. The early stages of cancer were there all along. Somehow, the pathologist had simply missed it. In the 6 months it was left unchecked and without treatment, it grew from a disease present in just 2% of the tissue sampled to a highly invasive cancer. Morales' world, along with her hope for a safe and happy life in Canada, were shattered. But there would be even more bad news to come, and this time it came in a notice from the federal government. Effective June 30th, the government changed its interim federal health program. That program covered refugee claimants with health coverage, including medical, dental, and drugs. The new policy cut off rejected refugees, those who had exhausted their appeals, from anything other than emergency life-threatening care or care for illnesses that pose a public health risk like tuberculosis. Unbeknownst to Morales and Nava at that time, they were considered failed refugees. Their claim was deemed abandoned because when they moved house, they changed their address with Citizenship and Immigration, but not with the Refugee Board. We will never know if their claim would have passed, but the federal government is no longer providing most health care to them, including Morales chemotherapy. Immigration Minister Jason Kenney touts the changes as a popular measure that's going to save Canadian taxpayers $100 million over 5 years. And he says fix a system long vulnerable to abuse.
The problem with the old, broken, dysfunctional refugee system that we're now replacing is that it created all sorts of incentives for false asylum claimants to stay in Canada for years, receiving generous social benefits, including comprehensive and even extended health benefits.
So you're a refugee claimant?
Dr. Ritika Goel says the new policy may have other, more dire consequences.
It's a huge danger. I mean, it's really only a matter of time before a life is lost.
Goel volunteers at a free medical clinic in Scarborough, Ontario that caters to refugees and new Canadians. She says the clinic's patient load has nearly tripled since the federal government changed its refugee health coverage.
I think what's even worse is that there are probably going to be people who don't go to the hospital because they're afraid of getting that bill. We're talking about people waiting, essentially, like I said, people with high blood pressure not getting treated, waiting to have a stroke, people with diabetes not getting treated, waiting to have a heart attack. We're waiting for people to essentially die before we take care of them.
The meanest, most vicious, and most discriminatory government policy against refugees since the Second World War.
Protests of the new policy started even before it took effect, and now a group of doctors and lawyers have launched a legal challenge, claiming the policy violates the Canadian Charter of Rights and obligations under international law.
Once people have been deemed by our generous legal system not to be refugees, they should leave Canada. They don't get to sneak in through the back door, and we certainly have no obligation to force taxpayers to pay for their health coverage, let alone their extended and supplemental benefits.
Jason Kenney starts with the wrong premise. He starts with the premise that refugee claims in Canada are bogus.
Raj Sharma is Morales and Nava's immigration lawyer. He points out they were and still are taxpayers. These days, Morales is too sick to work. Nava struggles to take care of her between shifts as a drywaller.
If it's not legally correct, it's morally incorrect. I think we have a moral obligation to provide health care to those individuals that require it, and I think we have a moral obligation to extend health care and health care coverage to those individuals that, by virtue of working and paying taxes, are paying into the system.
Maria Morales is receiving her life-prolonging chemotherapy treatments from Alberta Health Services, but only, says lawyer Jeff Poole, because she was misdiagnosed.
The doctors are being asked by Alberta Health Services to provide Maria with care and not be paid. And so it's an ongoing question for Maria and her husband Ivan as to whether or not they will get a huge bill at some later date.
The irony that Morales would not be getting any treatment at all if not for an alleged medical mistake is not lost on anyone, least of all her.
Y me están ayudando. O sea, me están dando el tratamiento.
They're giving me the treatment. At least with the treatment, they're helping me, but only because what I believe is negligence that happened at the hospital.
La negligencia.
Morales is suing Alberta Health Services and the pathologist for missing her cancer when it was in its early stages. Because the case is before the courts, AHS has declined our request for an interview, except to confirm it will continue to provide chemotherapy for Morales. She and Nava have applied for permanent residency in Canada, no longer based on the fear they say they still have of returning to Mexico, but rather on humanitarian grounds because of her aggressive cancer. Morales is trying to make peace with the circle of life, with her God, and she's holding out hope her grown son will be granted a visa to visit.
Hay veces me dan ganas, o sea, con esta enfermedad no puedes saber.
You see, with this disease, you can never know when I will die. This is what scares me a lot, not being able to see my son again.
Carolyn Dunn, CBC News, Okotoks, Alberta.
So how many refugees are there in Canada without health care coverage? The government doesn't track people leaving the country. But according to Citizenship and Immigration Canada, there were about 53,000 failed refugee claimants in Canada in 2010. That included 15,000 people ready to be removed from Canada and another 38,000 whose whereabouts were unknown.